Hi everybody, my name is Fabienne Carré and I will comment a video of cochlear implantation revision surgery with the robot-based assistance performed by Yan Nguyen and edited by Wangxi Gu. Here's the patient history. We report the case of a 47-year-old woman presenting with the history of a postlingual progressive deafness. She was implanted twice on the right side in 2002 and in 2006. On the left side, she was implanted in 2013 but showed poor results. She suddenly felt the sensation of a sudden noise showing a dysfunction from the right CA. Preoperative CT scan showed the full insertion of the electrode array and integrity test confirmed the device failure. Here's our different surgical steps. We can see here the electrode array path and the previous posterior tympanotomy filled with fibrosis. With the micro-hook, we gently release the electrode array from fibrous tissue in order to expose the round window. Be careful not to extrude the electrode array before exposing the round window. You can see in purple the relief of the lateral semicircular canal and the facial nerve third portion modeled by the yellow dashed line. The promontory overlooks the round window. Hyaluronic acid gel is filled around the electrode array insertion in order to avoid blood contamination. You can see here that the previous receiver is removed by unscrewing the device. Be sure not to explant the electrode array. Once the receiver is removed, the new one is placed at the same place. You can see here that we chose a new Oticon Neuro ZTI, which is very thin and smaller than the previous one. Therefore, there is no need to drill the bed and we can directly secure it with a new screw. The robot system is placed in front of the surgeon. It is quite easy to place it over the patient. You can see here the robotic array holder on which the electrode array is attached. The robotic array holder is itself mounted on the robot arm. The array is clipped 2 mm above the pushing rings into the groove of the robotic tool. The robot is teleoperated with an interface in order to drive and place the array right in front of the round window. You can see here that the electrodes are facing the superior part of the surgical exposure. The former electrode array is still in place in the round window niche. The view of the surgical field allows us to see both electrodes array at the same time, the former one and the new one. We can now proceed to the withdrawal of the failing array manually with an ear forceps. We remove it softly in a non-traumatic way. The round window is now exposed and free. The shortest time the inner ear is left opened, the better it is. We now proceed to the electrode array insertion, visualizing the round window. We can assist to the first electrode penetration. When the first electrode is into the cochlea, we proceed to a very slow insertion. The insertion is very smooth and there is no tremor. The insertion is continuous at a mean speed of 0.3 to 0.5 mm by second. The insertion is fully driven by the robot, but the insertion axis is determined by the surgeon. The robot assistants help the surgeon to obtain a very regular gesture and a constant speed. We insert the electrode until the pushing rings are placed against the round window niche. Once again, the insertion is very smooth. The electrode array penetrates electrode by electrode in the round window niche. Once the electrode is totally inserted, the PICS helps to remove the robotic array holder without being harmful. The array is now released from the robotic arm, and the robotic arm is removed from the surgical field. Surgery is finished. We will now secure the array with muscles and fitting glue, and we will close the muscles and skin incision. The electrode array holder is gently removed out of the surgical field. The new electrode array is perfectly in place. Be careful not to mobilize it, getting back with the electrode array holder. Here's the take-home message. First, it's important to reduce duration between the former array removal and the new array insertion. Then you must keep intact the former array for failure investigations. Then the robot-based assistance allows a very slow array insertion. Thank you for watching, don't forget to subscribe and see you in the next video!